In this video, I will explain donating and receiving A negative blood type. So let's start with a patient who has A negative blood type. A simply means on the membrane of the red blood cells of this individual, we find A antigen. Negative means on the red blood cell membrane, we do not have Rh factor. And the rule is the immune system builds antibodies against the antigens that we do not have. So the immune system of this patient, because the patient red blood cell does not have B antigen, builds antibody against B. So quickly, that means this patient is not okay with receiving B antigen. And also we know in a negative blood type individual, the immune system builds antibody against Rh as soon as the body is exposed to Rh factor. So in short, this patient does not accept receiving Rh factor. Now I look at the 8 potential donors that I have and one by one approach this process. First, because my patient has antibody against B antigen, those donors who have B antigen should be eliminated. Their blood type is not accepted. And we know that B blood type and AB blood type both have B antigen. So my patient does not accept these 4 blood types. Then the remaining donors, I pay attention which one of them has Rh factor, because my patient is against receiving Rh factor. And clearly we know that Rh factor is present in positive blood types. So all the positive blood types should be eliminated from the list, and I end up with the 2 donors that my patient with A negative blood type accept their blood. One would be the exact same blood type, and the other one would be the blood type that in theory we call it universal donor, O negative blood type. Now I switch the story and I pay attention to what if my donor has A negative blood type. And in donors, always we pay attention to the antigens and we make sure that the patients that accept those antigens receive this blood. So basically in my patients, I look for the ones that are okay with receiving A antigen. They're not going to attack A antigen. Again, step by step. We know that we have anti-A antibody in individuals with B blood type and O blood type. So these patients do not accept receiving A blood type. And then out of the remaining patients, I pay attention which one of them is okay with receiving this red blood cell. Since the red blood cell has only A antigen, I notice that all remaining patients are completely fine with receiving a red blood cell that carries only A antigen. So in short, a negative blood type can donate to both positive and negative blood type. And as you can see, again, A negative could be easily donated to AB positive and AB negative.